Welcome, everybody. I want to start off by thanking Nebraska Cancer Specialists for sponsoring all of our Create Your Best Life events, including our session today. Nebraska Cancer Specialists is a proud supporter of A Time to Heal. For more information on Nebraska Cancer Specialists, please visit nebraskacancer.com. Joining us today, we have Marcia Cederdahl. Marcia has been a registered nurse for 45 years. She started working in hospice in 1988 and started 3 hospice programs. She is certified as a hospice and palliative care RN, and she is LNEC trained, which is End of Life Nursing Education Consortium. She was an educator for in-home care and outpatient services with Nebraska DHHS for 10 years, which included home health and hospice. Marcia is also a 2-time cancer survivor. She is currently serving her 2nd term on the Nebraska Palliative Care and Quality of Life Advisory Council. Welcome, Marcia.
To be certified and have that additional education. So in 2012, I was diagnosed for colon cancer, and unfortunately, I had emergency surgery. I had a baseball-sized tumor in my colon and ended up having emergency surgery, so had a temporary colostomy, and then I had a year, 9 months, I think it was, of chemotherapy. And so while I am 10 years out, my oncologist tells me that you have to wait until you're 10 years post chemo. So it'll be 2023 when I am actually at 10 years cancer free. And then in November of 2020, I had surgery for a parotid gland tumor. And it was a stage 3, which was a little scary. I'd had it biopsied before and ultrasounds, and they diagnosed it as a pleomorphic adenoma, which is a benign tumor. But this time it started to grow, and there is a 20% chance that those can be cancerous. So they sent the biopsy to Mayo Clinic, and lo and behold, it was stage 3. So I ended up being followed with 30 radiation treatments, which what really, wasn't bad at all. Actually, I have to go in for checkups every 6 months, and I just had my 6-month checkup on Thursday, and I was telling Kelly, I know what it's like as a cancer survivor when you have to have tests done and then go see the oncologist. You're always a wreck, at least I am, before I go. And so it was just such a relief to know that Dr. Stava said, you're still cancer free. So I am truly blessed, and I feel like the reason that I'm here, that I'm on the council, is because as a nurse, as someone who's been through cancer twice, and I've had the whole gamut of, surgery, multiple surgeries, chemotherapy, radiation. If there's somebody who needs someone to talk to who's been there, I can help and lend a hand. So that's my story. And the Nebraska Palliative Care and Quality of Life Council is something I have really wanted to be a part of because of my passion for palliative care. And we were so fortunate to have Mark Coulterman, who actually is termed out this year, so he won't be in the unicameral anymore. But he is the one who introduced the bill, which was the Palliative Care and Quality of Life Act. And part of the reason Mark introduced this was because he had a wife who ultimately died of pancreatic cancer. And he was very much wanting people who have been through this to be able to get some help. So the law kind of created 2 entities. One of them was the education program, and I'll show you that website before we finish. And we had to have that up and running by June 30th of 2018, which we did. And then the second piece it did was create the council, the Quality of Life Council. So part of our job as a council is to consult and advise DHHS on matters related to palliative care initiatives. There are 9 of us on the council. There's 2 nurses besides one other besides myself. We have a couple physicians, also have social workers. Wonderful, wonderful council to work with. They have been a true joy. We serve a 3-year term, and then you can serve a second one, which I'm currently serving. So, what is palliative care? You know, I have been so surprised with the number of people that I have talked to just in the last couple months, I think, in particular, that think it's relating to end-of-life care. And it is not always. Palliative care is specialized medical care for adults living with a serious illness. It's focused on providing relief from the symptoms and the stress of dealing with a serious illness. And the goal of that is to improve quality of life for both the patient and the family. You know, when you are the person or the caregiver going through this, it is really stressful, and you often need additional resources. So palliative care is provided by a group of specially trained doctors, nurses, other specialists who work together with the patient's other doctors, kind of to provide that extra layer of support. If you remember nothing else, remember this last sentence, paragraph. Palliative care is based on the needs of the patient, not the patient's prognosis. The care is appropriate at any age and at any stage in a serious illness, and it can be provided along with curative treatment. So on the council, we actually have one of our physicians is Dr. Andrew McFadden, who's wonderful, and he is the director of the Children's Hospital Palliative Care Program. You know, they frequently have around 200 kids on their palliative care program. They may be on there for a long time and then go off. A small number of them go on to need hospice. But remember that palliative care is based on the needs, not the prognosis. It's appropriate at any age, at any stage in a serious illness. So one of the things I wanted to define for you is, what is a serious illness? And it's any health condition that carries a high risk of mortality and either negatively impacts the person's daily functions or quality of life, or excessively strains their caregiver. And that's a whole lot of diseases, diagnosis. We can go ahead and go on what those are. And you can see it's a pediatric serious illness, Alzheimer's and related dementias, certainly cancer, COPD, chronic obstructive pulmonary disease, congestive heart failure, kidney disease, stroke. One of the things that certainly come out in the last couple of years is COVID. There's a lot of patients, particularly long-term COVID patients, that would qualify for palliative care. So you can see any of these diseases, and I'm sure there are several more that would be appropriate for palliative care. The key concepts, again, is that it's person and family-centered approach to care. Whether you're the patient or the caregiver, it's really, you're dealing with a whole lot on your plate, and having an extra team of support to help you through that, and your caregivers through that is wonderful. It's inclusive of all people living with a serious illness. Doesn't matter where they live, doesn't matter what their diagnosis is, doesn't matter what their age is or what their prognosis is. You know, with hospice, because that's frequently brought up, you have to have a terminal illness, and Medicare requires that you have a life expectancy of 6 months or less. So hospice always is palliative care, but palliative care is not always hospice. And as we've gone out on the council and done talks, one of the things we've said to people is, as a clinician, you right now are caring for people with a serious illness. You just maybe don't think about it so much, but it is your responsibility as a clinician and as a social worker or a chaplain to know how to care for people living with a serious illness. And frequently you do. And there is lots of education out there that's available. So what do we do as the palliative care team? So one of the first goals that the palliative care team may be called in for is to relieve symptoms and distress. You know, if someone's having unmanageable symptoms, that's all they can focus on, whether it's pain or nausea or whatever, shortness of breath, whatever the symptom may be. So once you get that under control, then you can start working on some of the other parts of it. And that includes understanding the disease and diagnosis. I think a lot of times people are so overwhelmed when they hear what diagnosis they have that they don't really, I just think they're too overwhelmed, particularly the first time or two, to be able to say, what does that mean? And how are we going to treat this? So the palliative care team can help step in and help that patient and family understand the disease and the diagnosis. And it's also really important to help clarify treatment goals and options. I think as a nurse, one of the things that I feel very strongly for in nursing is that we be the patient advocate. And I think a lot of times patients don't understand, if I get this treatment, this is what some of the risks are. So you really need to be informed of whatever treatment you're getting, are the risks and benefits, and look at all of your options. You need to be able to understand and support the ability to cope with your illness, and then assist with making medical decisions. A lot of times people don't have, more than they used to in my years as a nurse, but a lot of times people don't have an advance directive. They are not sure what direction to do. So having someone that can sit down and go through that with you and explain what that means is so beneficial. And then coordinating with other doctors. The palliative care team is not there to supplant your attending practitioner, certainly not, but there to support both that doctor and free them up a little, because this is the training that the palliative care team has, that extra ability and training to be able to take the time to sit with the patient and their caregivers. So I thought of some questions that you might all want answered, and certainly will do my best to try to answer those. The first question is, where do people receive palliative care? Anywhere, really. I mean, it can be at the hospital, it can be in an outpatient clinic, and it can be at home. I think all of the major acute care hospitals in Nebraska do have a palliative care team. I'm not sure how long ago that occurred, maybe, I don't know, 10, 15 years ago. And there are more outpatient clinics than there used to be. And at home, both certainly they can have it under home health. And that was the next question about, does insurance pay for palliative care? Most insurance plans, including Medicare and Medicaid, do cover palliative care. However, for instance, home health, if a patient meets the criteria for Medicare home health and most insurance home health, they need to be what we call homebound. And that means that they really can't go out of the house other than maybe for doctor appointments, or I think sometimes to go to church. Well, you know, if you're a patient with a serious illness, you want to live the life to your best of your ability, and that may include going on vacation. So it's kind of rough trying to get covered under home health. But I think that's changing. I know that CMS, which is part of the federal government that writes the regulations for Medicare, is looking at options for palliative care being reimbursed a little better than it is. It certainly can be covered. It's not quite as good as we would like to have it.
Marcia, we do have a question here. You had talked about the palliative care team on a previous slide. And so can you share a little bit about what type of medical professionals are typically on those palliative care teams?
Sure. You know, I think a lot of times it is, it's certainly nurses, and a lot of times it's a nurse practitioner. And what actually I've worked for hospice and palliative care programs, and that's what it was. Physicians can be part of that team and often are. Social workers, I think they have to be master's level, special prepared. They are the ones that can help with any advanced directives or care planning needs that you might have. But really the intent is that it's the whole team of people there to support you, whether or not they get reimbursed for it. There are probably, I don't know, half a dozen, maybe more programs across the country right now that actually have been doing palliative care in the community for a long time, and they provide that training. So Bluegrass Navigators is one I'm thinking of right now. They're a wonderful program out of Kentucky, and they can send a palliative care team. Anybody can send a palliative care team there and learn how to provide that. So it's all the disciplines that are appropriate for that patient and caregiver. Hopefully that helps.
Yeah, thank you.
You bet. So what can patients and/or clients expect from palliative care? You know, I'm one of those old nurses that still calls patients and not clients. They can expect relief from symptoms such as pain, shortness of breath, like we talked about, fatigue, constipation. Boy, that's a big one, particularly if they're on opioids. Nausea, loss of appetite, difficulty sleeping. Again, palliative care is helping those patients carry on with their daily life and their ability to function. It improves their ability to get through medical treatments. You know, if you have a doctor visit and you're not sleeping or you're in a lot of pain, trying to get to that appointment itself can just be exhausting. So trying to get all those physical symptoms under control certainly helps get them through the medical treatments. It helps them better understand their condition and their choices for medical care. You know, I think with any serious illness, it's so important, if you're the patient, to have somebody go with you to that practitioner appointment. You know, my husband was, in fact, I just had my last appointment Thursday. He goes with me to all of my doctor's appointment. And when you're first diagnosed with that disease, whatever it is, illness, that's all you hear. So having somebody else there that can absorb some of that and relay it back to you and maybe be the one asking questions is really important. And then the last question is, how does palliative care work with treating providers? So as I've said, the palliative care team works in partnership with the provider, and the goal is to provide that extra layer of support to the patient and family. The team is experts in symptom management and taking that extra time for communication about their needs and treatment options and helping them navigate the healthcare system. You know, it's so complicated right now with healthcare, and so knowing where to go and who to talk to and what do you do next is part of the work of the palliative care team.
Mm-hmm. Marcia, I'm just wondering, you know, so much you already talked about is, I really don't know too much about palliative care, but I am a little bit familiar with hospice, and seem like a hospice team does all these wonderful things that you already described. And I am aware that to be eligible for hospice, that you cannot seek for the active treatment. So
Right.
it's, if you go for palliative, then can we still go for active treatment?
You bet. You bet. Yeah, that's one of the things that can happen, is that you can get that concurrent care. And actually, I think it's been a couple of years ago now, but as again, as CMS is looking at payment models, one of the things they had going on, I don't think we had any hospices in Nebraska that were part of this group, but they did have some hospices across the country that allowed patients to get concurrent treatment, curative treatment, while they were on hospice. So yes, unfortunately right now you can't do that in hospice, but if you're strictly palliative care, you certainly can.
Thanks for that question. I have another question here too. So you kind of shared what clients can expect from palliative care. Can you give a little bit more of like a specific example, like of symptom relief, of like what that exactly would look like for a specific patient? Whether it be some of their symptoms. I don't know if that question makes sense, Marcia.
I think so. So thinking of some of the nurse practitioners that I've worked with, it involves doing a visit. You have to have good assessment skills as a nurse. You'll be going out and assessing that patient and figuring out what is going on with them, and so if it's shortness of breath, for instance, it's listening to those lungs, seeing what meds they're on, and then consulting with their practitioner to see about getting, there's other things you can do for shortness of breath besides medications, turning on a fan, opening a window. But if all those have been tried and that patient's still suffering from shortness of breath, then it may involve that palliative care team member contacting the patient's practitioner, getting some meds ordered, and then following up, doing another visit the next day. It should not be just telephone calls, because you can't assess someone over the phone. You really need to get out and do that visit and see how it goes.
Thank you for that.
You bet.
Another question that we have here, it just says, how does one go about asking your physician to recommend palliative care? Or perhaps what do those conversations look like? You reference the importance of having a caregiver, if you have that, to be able to advocate and take things in, but what does that look like?
Well, there aren't, I think, as I said, in the hospitals and in outpatient clinics in Nebraska, we do have palliative care teams. And at home, it's either probably under home health if the patient meets that criteria. And so there's not as much community-based, but it shouldn't look much different, frankly, than a hospice team, except it's palliative care. So I know one of my last positions was at the Nebraska Healthcare Association. I was the director of regulatory guidance, and people knew that I was a nurse and palliative care trained. And so they would call and ask that very same question. My doctor says I need palliative care. And it'd be like, well, here's your options. And so it is working with insurance companies to see if they will not provide it. Certainly, one of the things that we have shown, not just in the council, but palliative care as a whole, is that it's a cost savings. If you've got somebody at home and they have symptoms that can be managed at home, which most people want, then it's a cost savings to keep them there rather than bringing them into the hospital. Did that answer?
I think so. Yeah.
Again, then do we like a palliative care? If we want to have palliative care, do we need to have a doctor's order, or can I just refer myself to it?
Probably need a doctor's order.
Okay. Thank you.
I received a comment in the chat box that said, in their experience, the doctor or medical professional will bring it up. If not, the physician is the one to ask.
Cool. Although patients certainly can ask, you know, if you feel like, hey, I've been diagnosed with maybe kidney disease. That was one of the programs I worked with when I worked at DHHS. Gosh, those patients certainly would qualify for palliative care. So that would be a question they could ask their nephrologist. How can I get some palliative care involved?
Great questions. Keep the questions coming. Feel free to come off mute, or you can also submit them in the chat box as well.
Sure. So I've got some resources here for you. One of the, over on the right-hand side is recommended reading. I had the privilege of seeing in person Atul Gawande, who is amazing, physician, and he's written this beautiful book called Being Mortal. I got to hear him speak at a National Hospice and Palliative Care meeting several years ago. And I know for a long time, you used to be able to hear, because he did something, I think, on PBS. I don't know if the video was still available, but oh, it's worth it. And if nothing else, the book is wonderful. And the other two are A Beginner's Guide to the End. And again, this is a little bit more for people facing a terminal illness, but it's also about living your life. And then When Breath Becomes Air. And then on
Marcia,
the other, yeah.
I have read that, Being Mortal, and I use it when I reference things all the time. I use it when I teach my time to heal classes, and I'm a therapist, and I use it when I'm working with people that have chronic illnesses, and it is wonderful. It's a little dry to get into, like the first part of it's a little depressing, but once you get into it, I use those 4 questions all the time.
Yes.
And I found it. There's another book that I used when my mom was going through some stuff. It's Your Mother, My Mother.
Oh.
And it is really good because it talks about the different stages and going in and out of them, and like what to expect next in the, you know, the in and the out stage, and then you get better and then you get worse again.
Right, right.
I actually read those 2 side by side, and so I get confused which is in which book. They're both really good. So
good. What's the name of the one? Your Mother,
My Mother, or My Mother, Your Mother, one way or the other.
Okay.
I'll try and go grab it and see if I can show it before we're done.
Awesome, thank you. Well, yes, I Being Mortal is amazing, and it is. He is a physician who was dealing with a patient who was dying, and he really learned a lesson from that. You know, as a nurse, sometimes I get frustrated that we feel like maybe patients don't understand. And that's where, again, I think the palliative care team can be so important, because we can help you understand the risks and benefits of what your treatment options are, because that's important to know. My Mother, Your Mother. Yeah. Oh, awesome.
And in the little print, it says, Embracing Slow Medicine, the compassionate approach to caring for your aging loved ones.
Oh, awesome.
But the stages are like compromise, crisis, recovery, decline, prelude to dying, and then death. And truly, when my mother passed away, it has like a step-by-step in the back, like what's going to happen with each stage. It was good.
Cool.
And I had both my brothers read it. So it's like, we're going to work on this together. We're all going to be on the same page.
Good for you. That's easier said than done sometimes.
Very much so. Very much so.
Yes, indeed.
Thank you, Karen. And I'll, sorry to interrupt, Marcia, I'll go ahead and in my follow-up email this week, I'll provide links to all of that so that you guys
cool.
can have them handy in one spot as well.
Yeah, I was going to just ask you, Kelly, if you can you pull up the palliative care page for DHHS? I want to show you guys that. Yep. That's what our council work has been. So it's an ongoing work in progress, but I think we've done a pretty good job of it. So just a sec here and we'll get that open, huh?
Yeah, just one sec. I just need to stop
Sure,
sharing the
sure.
PowerPoint and pull that up. One moment.
Okay. There's tons of information on there. We have it developed so that there's a section for patients and families. There's a section for medical professionals, and just lots and lots of resources.
All right. Can you guys see the DHHS page now?
Yeah, thank you.
Yep.
Yep. So yes, and one of the things that we have started doing there, myself and a couple other people on the council are trying to meet monthly and get more information out on the webpage. So one of the things that we have started doing is putting like little bullets at the top. So you can see one of the things we recently added, because we just found out about it, is that we're going to have the proclamation signing for Palliative Care and Hospice Month, November 7th. November is that month. So information like that, that's very timely, we try to put up there. And then there's also, as I said, resources for providers, a lot of information for patients and families, and information about us as the Palliative Care Council. We put our agendas out there, we put our minutes out there. So yeah, it's an ongoing work in progress, but I think we've done a pretty good job.
Thanks, Marcia. And obviously this conversation today is a lot of education and how patients can access palliative care and so forth. But there are some medical professionals on the call today, even patients that perhaps want to give back or to be more involved in some advocacy. I've joined this council a couple times just as a guest. Can you speak to that? Just like that folks are welcome to join and kind of hear more about what they're doing.
In fact, if you go to the council page, Kelly, it should have, I don't know that we've got the agenda yet because I'm not sure. I know we've got a draft. Our next meeting is September 12th. But we do put, and we're so proud of the report that we've done. And one of our goals with that is to get it around to all of the 49 state senators in Nebraska. So that's our next goal. But the meetings are open to the public. And we have an agenda that comes out, and then we put in our minutes when we're done. And when did we meet last? June was our last meeting, and we had I think 17 other stakeholders that were on the call. We were so excited because, oh, thank you. There is our report. Stacy Sinclair is the vice chair, and she actually was the one that pulled a lot of this together and did a wonderful job. So not only do we talk about what palliative care is in Nebraska, but we talk about our accomplishments. We talk about our goals and what we want to have going on into the future, some of the challenges that we've had. Certainly COVID was a big challenge, and it was a huge challenge for us as a council, because several of our council members are still practicing and they had a lot of patients to care for. So we really just started picking up steam again this spring. We do meet quarterly. So yeah, we'd love to have people that are interested attend. Maybe send Kelly an email, and then I can send her the information when we get ready to do the September meeting.
Thanks, Marcia.
You bet.
Do you want anything else from this page or back to the slides?
Oh, I think that pretty much covers it. There is a lot of information out there, so hopefully people, if you just do Nebraska DHHS and then in the search box do palliative care, that will bring up the web page. When we first had it up, I had a horrible time finding it, but it's a lot better now than it used to be. So
Thanks, Marcia. And I can go ahead, like I said, and include some of this information in our follow-up email in regards to the links and maybe some of these slides as well. So folks can access it easily through that email as well.
That'd be great. The Hospice and Palliative Care Association, we work very closely with. I was on their board for several years. We had our annual meeting conference in Lincoln. Golly, I don't know how many years they've had that, but actually we got to do it in person this last March. And we had a palliative care track, which I was so excited about because it is different than hospice. And we want people to understand that. Very well attended. And then the other one, I think they're all important, but CAPC, the Center to Advance Palliative Care, is a wealth of information about palliative care. There's toolkits in there for practitioners. So it's a wonderful, wonderful website to be able to look at. Legal aid for Nebraska, knowing how to get help that way. There's just lots and lots of, we are fortunate in Nebraska that we do have a lot of wonderful resources, including, of course, A Time to Heal.
I am just wondering, Marcia, you have this team, right? Palliative care team, but I don't know, I haven't seen a spiritual part of it, or do you include the spiritual part?
Oh yeah, you betcha.
It just seemed like when we are sick, we have this spiritual part is a very big thing, to me it was, and so I just was wondering whether you have that help.
You bet. Spirituality's a huge part of palliative care. Certainly for me personally, being a 2-time cancer survivor and a hospice and palliative care nurse. But you bet, the palliative care team should have clergy available. And the ones that I've worked with, often, as in hospice, families might have their own pastor, but if not, then that's definitely, it should be a part of it. A lot of times symptoms are not just physical that need to be treated.
Yeah, but you normally do not have spirituality included in your team, right? Is that it? Like the pastors, I respect pastors and they do a good job and all that, but then I think there is certain skills or something that needed to take care of or deal with the people who are really chronically and terminally ill.
Yeah, I think spirituality should be a part of any type of medicine, frankly. So I wish the model that we have for palliative care and hospice would apply across the board to all types of medicine. It's meeting the needs of the patient and the family where they're at, which includes having spiritual care when the family desires it, patient and family.
Mm-hmm. Does the book, The Being Mortal, includes or talk about that? Okay.
Yeah, he does.
Is this just book or is it the movie also?
Well, there's the book that came out first, and then he did the video on PBS. And again, that's been probably, 5, 6, 7 years ago, maybe when I saw that. But it might still be out there. I bet if you did YouTube or something, you could probably find it.
Okay, thank you.
You bet. Yeah, there are lots of different conversation starters. Our children are used to having a mother who works in hospice and palliative care. So they're very comfortable when my husband and I, we have all of our advanced care planning done. And actually, I didn't get it done until my brother, who was 6 years older than myself, died way too early at 68. And it made me think, okay, I need to get this done, my husband and I, because I don't want our kids to be faced with not having things taken care of. So there's lots of different conversations that you can have with your family and friends. The hello game, I think I had one I was looking at the other day, is just a little tiny book, but it's got different questions, and they are very provocative, and people need to know, you know, you don't want to end up in the hospital for whatever illness it may be and not have anybody know what your wishes are. So this is kind of a gentle way, I think, for you to get in there. 5 Wishes is an amazing document, very, very comprehensive on what you want done as far as your wishes and preparing for the end of life. And then additional links. AARP is wonderful. Get Palliative Care is also part of the CAPC system, and they actually, you can go into that page and it will direct you to where there are palliative care teams available throughout your state. So that's another helpful one.
Thanks, Marcia. We just had somebody submit in the chat box. They said that they have used 5 Wishes with both of their parents, and it is a comprehensive and in a kind and caring way. So they had good things to say about it as well.
Yeah, it's very well done. You know, I think it's been so long ago that I first heard about it. I had copies, then I got copies for all my kids. We were just kind of starting that conversation. They were like, ooh, what's this about? But yeah, there's nothing wrong with talking about it, you know, and being prepared, because when both my parents died, my brother died. If you don't have your ducks in a row, you know, you've left a whole lot for your family to have to deal with while they're grieving, which is tough work.
Thank you, Marcia. This has been really helpful for me to better understand palliative care. At this time, we're going to just open it up. If anybody has questions, they can feel free to come off mute and ask questions. You can feel free to submit some in the chat box as well.
Well, thank you for allowing me to do this, Kelly. I just, you know, I don't remember if I brought it up on the call. I know I did with Kelly, but as a nurse, as a 2-time cancer survivor, having been through all the different types of treatment, I just feel like part of the reason that I'm still here is so that I can give back to other people. So if you know someone that could benefit from having somebody who's been there, you know, feel free to reach out.
Thanks, Marcia.
I'm just wondering whether, you know, like you were saying, that not many people really understand the palliative care, what it is and what's all involved in and all the stuff. And so I'm just wondering, you go to different places and they give a talk?
Yes, yes.
So like, for instance, if I want to invite you, then would you come?
Sure.
Oh, okay.
Yeah, I several different council members, Stacy and I have done a lot of them. Actually, Dr. McFadden, last year, there's a program on PBS, and of course now I'm having a senior moment, can't remember the name of it, but he did some speaking during Palliative Care Month, and it was recorded, so it went throughout the month on palliative care. And I think that's one of our, I don't know if mission's the right word, but certainly one of our kind of is for the Palliative Care Council, that we educate everybody on what palliative care truly is. And one of the things we can get from speaking is interaction like this. And so we've done a lot of them on Zoom because we've had to the past couple of years, but we are also starting to do more in person. And I just think the opportunity so that people understand that palliative care, number one, is for any age. at any diagnosis. And certainly number two, you can get it along with curative treatment, and it isn't always end of life care. Is really important to know the truth behind that.
I just wanted to say that in 2016, I was diagnosed with ovarian cancer, and it was stage 3C. And I was in pretty bad shape. And then they did a debulking procedure, and I barely made it through that. And in the process of that, my husband asked for palliative care, and that's basically what helped me get through it.
Thank goodness.
And it was, of course, luckily for me, I don't remember most of it because my brain wasn't working. So to speak.
I've been there. I get that.
Yeah. Anyhow, so that's kind of why I just wanted to be on this today too. I mean, not just to say that I'm a very big advocate of it, which
Wonderful.
Because of my own experience, but that people, I am a nurse, and I did work in my church as a parish nurse after I retired. And anyway, but so many people don't understand the difference between palliative care and hospice. And if you bring up hospice, they just write, well, I'm not dead. I'm not going to die, and it's just like they don't want to get into it at all because all they know is that, my friend or anybody who's been in hospice is like been in hospice and died the next day. All they do is kill you. And when my mother, when my mother was 96 years old and in excruciating pain, and it just was horrible. And and the palliative care doctor that I talked to, and this was she was up in Minnesota, and I was in Omaha, and she said to me, when the pain was so excruciating, she couldn't stand it anymore. She says, well, are you okay with hospice? And I said, well, yes, of course, this was before what I went through, but I said, yes, because I knew from my experience that hospice would help. And at that point, I mean, she didn't have anything except this horrible pain that was killing her, but nothing that, anyway, she was on hospice for 11 months. And then she didn't qualify anymore, but she could have been on palliative care.
Sure.
As far as that goes, but hospice continued to stay with her because she continued to qualify, and they put her on a methadone treatment, which when they finally got to the regular dose, she really did well, and basically eventually, of course, died, but not because of the pain, but because she was just old and she wanted to die. But and I understand that part, but it was so wonderful that she could be pain free for the rest of her life.
You bet.
So anyway, and I keep telling people that I said, you don't want to be like this. You want to have help.
That's
anyway, my 2 cents. But thank you for your talk, because I really appreciated what you said, and for the amount of information that now I know is available. Thank you.
Well, thank you. And I, like Karen said, and for the rest of you, please educate people when you have the opportunity to explain to them that palliative care is not just end of life care. So it's anybody with a serious illness, any point in treatment, they can get curative treatment along with it. And it can be so overwhelming. So knowing that difference, I think, is helpful. When it's appropriate, hospice is wonderful. I was a hospice nurse for years and years and years, but there's no reason, if you've been done. In fact, that's when palliative care should be started. When your practitioner shares with you that you have this diagnosis, at the same time, wouldn't it be wonderful if they said, and there's this program called Palliative Care. Let's get you involved in that. And our goal is that someday we'll get there.
Yeah, exactly. Yeah, thank you.
Thanks, Karen.
Yeah.
That's really helpful. Helpful to have that insight from you as well. We do have a question in the chat box that says, where can we go to start your wish list before you pass? Is that an insurance ordeal?
I don't think so. With some of the resources up there, 5 Wishes is a perfect place. So if you're looking at doing something that honors all of your wishes and what you would like done, that'd be a great document to start. I think I started to say, I'm not sure I finished it, but I think that came from the Florida, if I remember correctly, who has the largest population of senior citizens in the United States. So it's been around quite a while.
Yeah, I use that at our church for the older people in the church when I was working there. And I can't remember the organization that I got it through. Shoot, sorry about that. But I had a whole bunch of of information folders, the whole bit that I passed out to everybody, and they and we use that for a lot of them, and it was really good because obviously in the last 9 years they have been used.
yeah, definitely. So actually, you can just Google 5 Wishes. And
I think you could probably get their forms. So that's what I would do if I was doing it again.
Yep.
Does anybody else have any questions they'd like to come off mute and ask? Go ahead.
I just was wondering, this palliative care, when you have a pain and all these problems, and I can see bring the team in, but I'm just wondering those people who really does not have that much problem, but diagnosis, you have to, so what benefit do they have if I just have a cancer and not having that much problems, pain or anything? Would I be still benefiting going into palliative care?
I think being aware, knowing what it is, knowing that there's support when you need it. Maybe, I started working in hospice in 1988. So when I first started as a hospice nurse, most of our patients were cancer patients, and they were these days, you admit somebody to hospice and you're lucky if they live a couple days. But back in those days, it used to be with the cancer patients, they had quit their treatment. And so we generally had about 3 months or so, maybe a little longer than that. And I would start out as a nurse, maybe seeing them once a week. And then you just increase the visits and the team members as the patients are needing it. So yeah, it's, I think just having that knowledge and knowing, okay, this is who I can contact when I need it, or my practitioner can contact for me, is very helpful.
Thanks, Marcia. I think a couple other people. Yep, go ahead.
Okay, my question is, if somebody has dementia, how can palliative care help them? Or is there, they're mobile and, they go to like an adult program in the morning, but like in this case, there's only one daughter who's here in the same state. So, I mean, it's all up to her, and she, so how can palliative care help in their situation?
Well, and I had worked with some nurse practitioners who did work with patients with dementia. And it's part of it is the extra training that the palliative care nurses have to recognize some of the symptoms that maybe the patient with dementia can't tell you. But for instance, sometimes when they're fidgety, maybe they've got a UTI, it's just knowing what to see. So it's assessing that patient. But you also mentioned the daughter. So a big piece of palliative care is working with her, getting the resources she would need to know what help is out there. It's very not just patient focused, but caregiver focused as well.
Well, thank you.
Mhm.
Did we have any other questions from the audience? Elaine just gave a suggestion on the Being Mortal. If it's on PBS, there's something called the PBS Passport, which has past videos and programs. And so not confident for sure that it's on there, but something to look into for folks that are interested. Thanks for sharing that, Elaine.
Yeah, thank you.
Any other questions? Otherwise, we can close up.
I really appreciate this and thank you so very much.
Oh, you're quite welcome. Happy to be a part of it.
Yeah, thanks. Thanks, Marcia. If anybody thinks of anything after this, feel free to reach out to us and we can circle back with you guys. Like I said, I'll put together a follow-up email this week with some of the resources that we discussed from Marcia's slides, as well as some of the ones that you guys suggested as well. So look out for that. If you guys ever have topics that you'd like to see covered in the future, please feel free. We do these events every month. Next month, we're going to do one on young adult cancer survivorship. And then in October, we're going to do one on survivor guilt. And so feel free to reach out if you guys have any topic suggestions, things that you'd like to see covered. But on that note, I think we'll close up and everybody enjoy your Saturday.
Thank you.
Thanks, Marcia.
You bet.
Thank you.
Thank
Hi,
you.
Karen.
Thank you.
Hi,
Bye.
Karen.
Bye, Hilda. Good to see you.